I'd like to welcome everyone to the second discussion session for the GeauxConsumerLA Health Initiative. This session is about what is the current state of health literacy in the United States. And my name is Julie Esparza, and I am the project principal investigator. And I have several different colleagues that are also helping out with this. The website is here. And just to go over a few things, this is an international educational program that provides free, short, on-demand consumer health for the librarian, information professional, or staff with an interest. If you take the Beyond an Apple a Day and complete the rest of the hours to make up 12 or 24, you can apply for the MLA Consumer Health Information Specialization. All the video session will be posted as soon as it's processed, unedited, and then once it's transcribed to meet the Section 508 standards, that will be put up and replace the unedited. Credit for these discussions may only be obtained after completing the project evaluation and the MLA evaluation, and attest that you completed the pre-session reading and watched the session. Those in Louisiana, through this grant, may request the specialization fee to be waived if they complete the appropriate steps. And you can go to the website once again for more information. This is our project website. These are some primary courses that are available, and they're all available via archived video, or they'll be upcoming. And then we have our discussion listing here. We would like to thank the National Networks of Library of Medicine out of the University of North Texas Health Sciences Center for the grant that has made this educational offering possible. So today I'm very excited to have Julie McKinney with us today. She is a health literacy specialist with 20 years of experience developing and promoting health literacy resources for adult educators and health professionals. She writes and puts together plain language health information. She also trains educators and develops health literacy curricula. And she has a focus on resources for teachers and health educators and enhancing collaboration between fields, which as librarians and information specialists we also have an emphasis on. She's also the moderator of the Health Literacy Listserv, which is an excellent group, and she keeps us all in line. So with that, I am going to now turn the machine over to her.
Okay, so thanks, Julie. Hi, everybody. This is great what the library here is doing to help people with consumer health information. And so I'm talking about the current state of health literacy in the United States, which is, and I'm just going to be talking mostly about sort of the updates on what the research tells us about people's health literacy skills in the U.S. and who who is having the most challenges and what kinds of factors help us to have better health literacy. I know that there was an article that you were going to read, and I hope some people read that. If not, you can read it after this, about health literacy disparities in the U.S., and we'll go over a little bit of that later on. So, in 2003, the National Assessment of Adult Literacy took place in the U.S., and it was a very large national study that tested literacy of U.S. adults, and it also had a health literacy component, which was 28 questions about health-related tasks, and it had people actually look at some health-related information or instructions that they might see in everyday life, and it saw how many people could do certain tasks as getting the information from that written health that written health instructions. So, so that was really the only large-scale health literacy test of the U.S. There are new assessments now, but right now that is the only one we have in the U.S. that specifically measured health literacy. And this here is what we found with it. And there's a few ways to look at it. Some people look at this slide and say, oh, more than half of the people have intermediate or proficient health literacy. But if you look at it in this way, that 12% really have proficient health literacy skills. And for subsequent studies indicated that you really do need proficient health literacy skills in order to take care of your everyday life, access the health system, understand the basic health information and instructions that you're going to get in the normal course of daily health life in the U.S. So that large piece of 52% with intermediate, they can get by, but not well. The bar was set pretty low with this assessment, and so you could still be proficient and still not get everything right. So that was sort of eye-opening. But then if you look at the two smaller pieces, the basic and below basic, so that's the blue and the gray ones, those people who tested at this level really struggle with understanding health information. So that is the segment of the population that really needs a lot of help, and we need to make sure that health information is easier for those folks to understand, but really for all of us, because this assessment showed that it's a bigger problem than we thought. It's not just people with low education. There's a lot of people, 88%, who really don't have enough health literacy skills to take care of their health well. But then if you look at it, if you break it down, you can see, and I think there's no real surprises here, who has the most trouble understanding health information. So what these percentages are what percentage those below basic and basic skills are. So these two smaller pieces of the pie. The entire population, 36%, have those marginal skills. But if you break it down to white, black, Hispanic, you see how the percentages really become very disparate. And again, I think this wasn't a huge surprise. Neither was the high school education statistic. So in those who were in finished high school, or were in high school or got their GED, their general education degree, that was, about 35%. But for people who didn't finish high school, 76% were in this marginal range. So again, that's not a big surprise. But it also tells us how even people who with high school degrees, this is a pretty large chunk who still have trouble. Please, if there are any questions, feel free to put them in the box. And my computer is set up in such a way that I can't see the box, unfortunately. But Julia perhaps could relay questions to me when you do have them. So I want you to feel free to do that. And Julia, please interrupt me if you see questions.
I will.
Thanks. I want to introduce RV Rikard, who is also on this call. He was the lead author for this article, Examining Health Literacy Disparities in the U.S., and did all the data work. So he's on the call and hopefully can help in discussing this. And this is, I know that this was something that some of you had read before this webinar. So RV, are you out there? You're probably on mute, but hopefully he will chime in.
He is on there, but he doesn't seem to have a microphone going.
Right. Okay. RV, maybe you could get your that set up. But anyway, so this article, Examining Health Literacy Disparities, this took a closer look at that same data that they used for the National Assessment of Adult Literacy, the NAAL data, and just looked at a few extra things, because they got a lot of background information from people in that study, but not all of it was analyzed. And so RV did a more detailed analysis of it, and he looked at the relationships between all of these different things. You know, age and gender they did in the NAAL, but they and I think they had household income, employment status, educational attainment. But we looked at a few different things also. We looked at civic participation, which they got that information, but just didn't compare it to the differences in health literacy levels. So we looked at people who vote versus people who don't vote, people who volunteer, people who use the public library, which of course is relevant to you all. And then, you know, languages spoken, marital status is something they got, but they didn't relate to health literacy levels, and then health information sources. So these are some extra things we looked at just to see if there were some social, relational, civic factors that affected their health literacy levels. And we also looked a little bit closer at race and ethnicity. And so this is what we've had. The regular NAAL, as we showed that whites had much higher health literacy skills than minorities. And hey, RV, there you are.
Hey, sorry about that. Apologies. Sorry.
That's okay. Thanks for being on here. So yeah, I'm just gonna just chime in. Or would you want to talk about this, RV?
You're good. You're good. Go ahead. I'll chime in you know, when needed. But you're doing great, Julie, as always.
Okay. Okay. So anyway, we see how even when we controlled for income, education, employment, and even language spoken, there were still these disparities in racial and ethnic groups. And I think that was a surprise, because I think most people thought, okay, well, minorities have lower health literacy skills because they generally have less education, less income, less likely to be employed at a higher level. But what we found is that even when you leveled the playing field for all of those things, there was still a difference in health literacy skills. So if you compare a Hispanic woman who's foreign-born with a white woman, they both have the same job, same income, same educational level. The woman who's foreign-born Hispanic will still have 5 times lower health literacy skills. So this was interesting, because it made you realize that there are some sort of persistent racial differences in how people have gained these skills, and that's something that we'd like to look at. So I apologize, this slide is not complete because I don't have the exact numbers in this form. We have all the data, but I apologize, I didn't get to put these numbers in. But what we looked at, again, controlling for these same things, we found that people who use the library on a regular basis are more likely to have higher health literacy skills. People who vote are more likely to have health literacy skills. So those are the civic engagement factors that we looked at, and found that people who are engaged in their communities to that extent have higher health literacy skills. Also learned that people who are married or living as married have higher health literacy skills than people who live alone. And then we found another interesting thing when we looked at language and people who have come to this country and, and we have Spanish speakers here who have not learned English, but they've been living in this country for most of their life. Those people have better health literacy than people who came here speaking another language and did learn English, which perhaps speaks to our, our need to improve our English as for speakers of other languages support systems in this country, and make sure that we can help people to perhaps gain English skills that support their health literacy skills as well. RV, do you want to add anything? Or I know there were some interesting things about using the library and how.
Yes, ma'am.
Yeah. Talk about that.
Sure, certainly. It's the library use. Folks who used the public library on at least frequently or occasionally compared to never using a public library, they were the ones who had the higher health literacy values or higher scores, if you will, versus those who never use, right? So people who were using a library at least occasionally, frequently, boy, they were off the charts. So that kind of says, so yeah, and this is, again, as Julie pointed out, taking into consideration all those other things like age, gender, income, education, employment status. In terms of the folks who vote, and this is the question when they were asked. The folks were asked in the NAAL, did you vote in the 2000 election? And the folks who said, yeah, I voted, okay, they had higher health literacy values, if you will, compared to folks who did not vote.
And again, controlling for all of these factors,
yep.
So they still have the same education and income.
We see now the Spanish speakers. That was very interesting, really interesting. So folks who learned who were Spanish speakers, they only spoke Spanish, right? Their level of health literacy was lower, right, compared to quote unquote primary language is English speaking, if you will, and then other language. So some other language other than Spanish. And English is, and learning some other language spoken, English is second language. We're talking like almost nearly a 20-point lower level of health literacy compared to those native English speakers, if you will. So these differences that we saw, it's like, okay, we can't explain it with any other demographic background variable or measure. So their folks are equivalent across, we take into all the different factors. Wow, it's only these factors.
So it was interesting because we saw how these factors of how people work in society, and not employment work, but how people move and interact in society here in the U.S. There are different things besides these age, gender, income, education that have an effect on their health literacy skills. So that was also interesting. Julia, did you say that you were you trying to break in? Do we have questions?
Yes. One person has asked, are libraries located in underserved, lower socioeconomic areas? How hard is it for a population to get to a library? And I'm not sure if she was just putting those questions out there for chat, or if she wanted us to ask that.
Right.
I'm
no,
not
that's
sure if your data can tell you, could allow you to comment on that.
I don't think our data can do that. We did have, we do have, the NAAL data is broken down by state, but we didn't, but it's not really broken down beyond that. And so we couldn't correlate the library use questions with geographic location. But I think that would be something that would be very different in different states. I mean, I'm actually doing some work in Louisiana, and we're working with the library systems, and it sounds like you have a very pretty extensive library system there. So Julia, you might be able to answer that better than we could.
Actually, I don't know if more libraries are located in underserved areas or not. That's something I've never looked at nor thought about. So that would be something to look up and add in as a follow-up.
Yeah. I mean, at least we do know that libraries are pretty well spread throughout most states, and I know in Louisiana I know there are a lot of local neighborhood libraries, but yeah, I don't have the numbers on that. But I think we do know that people people in with fewer resources do use libraries for information, and they do, and I think a large piece of that is health information. So we know that people are using libraries to access health information. I have a couple of slides at the end about that. Thank you. Anything else, RV, on this?
Well, just Julie, and I don't want to go ahead of you there, but there is a report from the Gates Foundation. It was supported by the Gates Foundation in 2012 about public libraries and what do people go in and look for? Health information.
Yeah. No, it's a very important venue for health education and health learning. So I'm going to move on and talk about the next level, the next adult competencies assessment. I'm just going to go back to this for a moment. So the NAAL was done in 2003, and it studied health literacy and literacy. Unfortunately, there are no plans to redo that same type of study, and instead they decided to do an international study, which is called PIOC, the Program for International Assessment of Adult Competencies. And this was done in 23 countries in the first round, and then they did several more, I forget, maybe 12 more in a couple of years later. And they tested for 3 different things. They tested for literacy, numeracy, and problem solving in technology-rich environments. And this is, in a way it's too bad because they used different, they used a different assessment, different, levels of skill. So we can't really compare it to what we found on the NAAL. So we can't really tell, are things getting better? Is people's literacy improving? Although we can tell that it does not look very, very good for the U.S. So these are how they defined literacy and numeracy. Unfortunately, also they did not do any health literacy questions. So this does not really tell us about health literacy skills in the same way as the NAAL did. Problem solving in tech-rich environments is using digital technology, communication tools, and networks. And so this is something that I think we can see on the surface that these skills are important for people taking care of their health, especially now with electronic medical records and just the way, more people now have mobile phones and access all kinds of information and communicate with their doctors in that way. So it's a key skill that people are going to need for health literacy. But again, we can't compare this to what we found before to see what the trend is. But what we could do from the PIOC was compare the literacy, numeracy, and technology skills with some questions they answered on a background questionnaire. So people did report their self-reported health status, whether they have health insurance or not, sources of information about health issues, and then a few questions about preventive health practices. So are people leading healthy lives? And so we can make some inferences about about literacy, numeracy, and tech competencies with health status and some of these things. So I'll get to those at the end, but let me just go through basically what they found. And again, we don't have the same types of categories of skills, but one of the things that was very telling was how the U.S. ranks. Oh, I'm sorry, I keep doing that. How the U.S. ranks in the first set of countries they tested. And just to be clear, like these are all industrialized, developed countries that they were testing. It was not like they're comparing the U.S. with countries that are at lower stages of development. These are all very highly developed countries. And so this is where the U.S. ranks. Close to the bottom, this is literacy. Our average score was a little less than the average. And then if you look at the U.S. compared to the international average in the types of levels. So again, they didn't use below basic, basic, intermediate the way the NAAL did, but these are sort of similar breakdown of categories. And as you can see, it's not that far off. If you're comparing this, I mean, again, this is literacy skills, not specifically health literacy skills. But you can see that it's about the same as the pie chart we looked at before. There's still 12% have proficient literacy skills. But you also see that the U.S. Adults, they have more people in the lower levels. If we look at numeracy, it's a little bit worse. Our average score was even lower than the international average, and there were only 2 countries that scored worse. So that's something that is hopefully going to spur people on to improve the education in math and people's sort of relationship with numbers in this country. And again, numeracy skills we know are very important in health literacy. There's a lot of numerical test results we get. We need to, look at charts to figure out if we can get Medicaid. There's all kinds of numeracy skills that people need every day to take care of their health. So we know this is important, and we know that we're not doing very well.
Julie, I have a question.
Sure.
Can you go back to that slide?
Yeah.
What does the difference between those mean? I mean, obviously we're way down from Japan, but what does a 246? What are we looking at in real terms of what the difference means when they're doing this?
Yeah.
Is there any kind of knowledge that you can put it in context?
That's a good question, and unfortunately, I don't think I can with these numbers. Like, this is really more useful as sort of a ranking than it is, it's hard to qualitatively say how much, what this difference means. Like, is, 253 versus 269, how significant is that? I'm afraid I can't really put that into words. I can tell you that the test was scored from 0 to 500. So 500 was a perfect score on the literacy and numeracy and tech skills tests. So if you think about it that way, then our score was basically a 50%.
Okay.
So RV, do you know if the PIAC was one of those where it gets harder as you answer the questions? I don't think it was. Do you know?
Yes, ma'am, it is. It was so much like the NAAL. What happens is that as you progress through the test or through the assessment, questions start off very easy, much like SAT, ACT, the graduate record exams, all these standardized type measures of academic achievement or whatever you may call it. The questions start off very easy, but then as you answer more correct questions, the questions become harder. And so if what you were saying about where are we in terms of other, that's about, I mean, you're right on the money. I mean, the whole scale is 0 to 500. We're kind of in the mid-pack there. But it is interesting that on average, when you start looking at this, Japan, Finland, Belgium, Netherlands, I mean, there's a lot of countries above compared to where the United States is at now.
Yeah. And I think the fact that it follows that pattern of the more you get right, the harder the next ones are, I think that leads us to believe that, a gap is more significant than it might seem. Because to get from 253 to 269, you're going to have to answer harder and harder questions to get that score. Thanks. Again, this is the way it pans out. We can also look at this, take this to find that, it's really, only the proficient skills are really what people need these days to take care of their health, understand health information, test results. So again, this still tells us that we need a lot of improvement, and people who are coming into the libraries for health information are going to need some guidance. Technology-rich environments, I'm going to try to just go a little bit quicker through these next ones. Again, we're pretty low. In fact, all of these groups at the bottom here in white are basically the same. There's no real significant differences between them. So basically, we're in the bottom group there, and this is how it pans out.
Julie?
Yeah.
There is a question. Do most of these countries that were in that other slide have government national insurance? Are they perhaps more invested in keeping their population healthy and informed?
Yes. I think,
sure.
Sorry?
I said I'm not sure. I think
Yeah.
some of them do have socialized medicine.
Yes, I think most of them do. So that may be a factor why the U.S. Has more trouble. I think our system, even for people who do have insurance, I think our system is much more complicated. There was a study that compared the United Kingdom with the U.S. in terms of how healthy people were and what the reasons were for it, and they factored out the health system somehow and found that the U.S. were still less healthy. I don't have that offhand, that reference, but that is something that I think needs to be looked into more. But because we do know that the whole health insurance issue makes the U.S. system much more complicated. But one thing we do know, and this may relate to that, is that the relationship between literacy and health status is stronger in the U.S. than in most other countries. So along with Germany and Austria, but really it's Germany and the U.S. And what that means is that Americans, we rely more on our literacy skills to stay healthy. So people with high levels of literacy are more likely to be healthier in the U.S. People with low literacy are less likely to be healthier, and that relationship is much stronger than it is in other countries. So if you get down to the bottom here, some of these countries, like Japan and Italy, even people with low literacy skills can have an equal chance to be healthy as other people, whereas in America, it really stunts our health in order to be less literate. Does that make sense? I know that's sort of a weird concept. And again, this just agreed with what the NAAL found. You know, people with higher income have better health. People with higher levels of education have better health. Like, again, this is self-reported, but so this just confirmed the NAAL data. So I think, I mean, even though we can't compare them directly, and even though the PIAC didn't test for health literacy skills, I think that it suggests at least that we haven't made great improvements since 2003 when the NAAL came out. And I think that's why RV and the other authors and I, you know, thought that it was worth using that data to look at some deeper issues, because it's likely that that data hasn't changed all that much. Again, we don't know for sure, but we have challenges. That is for sure. So I'm gonna try to move quickly, because I know it's, you know, our time is almost up. This is these next few slides are just part of an infographic, and you have the link down here. Julia is going to share all the slides with you, so you'll have these slides, and you'll have the links, and you'll have access to this infographic. The next few slides show different pieces of it, but this is talking about how libraries can be heroes in health promotion, and these are some of the numbers that support that. You know, we know that socioeconomic factors are very important in health outcomes. And again, that your question, whoever that was, about, you know, libraries being in neighborhoods that are more challenged socioeconomically, again, that's going to be a really important thing for helping people with their health. And this is why people use the public computers. People go to libraries for health-related information, and this is the cool one. Almost 3 in 4 people say that libraries help them find the health information they need. And one of the reasons why libraries are important, especially given the disparities and the challenges with people with who are minorities or low socioeconomic status, libraries sort of even the playing field in some ways. People can find the information. Anyone can use the library. They can use the public computers. So these are some of the ways that libraries help people. Okay, and again, you'll have this slide, so you can give it a look later. And just a quick plug. I mentioned I'm working in Louisiana, and this is just an example of how the libraries are helping with this particular project. This is a project that it's a website for parents or caregivers of people with disabilities, and it's a health literate resource. It's written in plain language. It's designed with health literate principles. It's tested with the right audiences, and the libraries have really come on board to help promote this. And I think we've sent 40,000 bookmarks to libraries all over Louisiana to pass out to people who are looking for this type of information. And we're going to go do a training of librarians to help people use this online resource to find the information they need. We're actually presenting next month at the Administrative Librarians Conference. So again, this is just an example of the way that the libraries can be involved in promoting health information that's easy to use, and in actually being trained to help people use health information. Because I know that the concept of libraries in Louisiana is very much a community service organization. So that's a very important thing for the people who have health literacy challenges. So these are just some resources. Again, you'll get all this, but they're just some resources about what libraries can do or have done to help promote health and health information. And the Medical Library Association has some very good online free courses for librarians to help with different health literacy practices. So I think that's it. Thank you guys for being here. Does anyone have any questions now? I know we sort of raced through this, but please, if there's any questions now, we're happy to take them. No? Okay. So again, thank you, Julia, for having us, and thanks everybody for coming to listen to this. If you have any other questions or need more information, please feel free to email.
Thank you, Julia. Our next session will be October 25th at noon Central, and we'll be very lucky to have Cynthia Bauer to talk about what are the national goals towards improving health literacy. The evaluation URL can be found in the YouTube description section. Please see it in order to claim your MLA credit. Thanks again.